of that company, Tony Wood, is here with us in studio, ready to give us deeper insights into just what exactly Dawa is and what it can do for you to make your health services that much better. Karibu sana.
Okay.
Yeah. Okay. Thank you for taking the time to talk to us, sir. Now, for many people, they're not essentially used to, well, medicine and technology. So I think a good place to start would be to essentially ask, what exactly is Dawa? What can it do for me? And how is that different from what I already have?
Okay, I think Dawa is an e-health solution,
yes,
and it's a technology-based solution, where really we're trying to just completely simplify the supply chain for pharmaceutical products.
Yes.
I mean, in a number of different industries, supply chain efficiencies are something that everybody's trying to achieve. What we try to achieve is that within the pharmaceutical industry, because at each step in that supply chain, cost is introduced, and that's a cost ultimately that the patient has to bear. So what we're looking at doing is completely simplifying that, bringing in efficiencies within that supply chain, which ultimately should reduce the cost to the patient. And also there's a very unique authentication solution that we've developed, which we believe is a first globally, where the patient can, or the consumer can authenticate
yes,
every product that they purchase from us.
Well, you said something quite interesting there in the beginning, the fact that the value proposition here first is the issue of cost, that this will enable people cut out the middleman and be able to achieve, price savings that normally wouldn't have accrued. Second, of course, is the ease of availability. So my question would be, is this currently available? How can we get onto this service? And what is the scope of coverage? Can we get it across different parts of Kenya, or are we just starting off in Nairobi?
Okay, so yes, it is currently available. You just need to log on to mydawa.com. It's available on the web, mobile, and it's an app for Android and iPhones. So it's available to download now. You can sign up and then interact with us immediately. There are a number of products on there that you can just browse and purchase, as in any e-commerce solution.
Yes.
If you have a prescription from a doctor, then you can upload that through the portal, and we will then, our qualified pharmaceutical technologists and pharmacists will transcribe that, and they'll dispense that into your basket, and then you go through and check out pretty much the same way you would do as if it was an ordinary e-commerce.
Let me just stop you there so we can literally take this apart step by step. First, you said available by mobile. So do we have a USSD offering, or is it just smartphones? Yes.
So at the moment, as with everything, you have to start somewhere. So we've started with smart. So you have to have access to the internet.
A smartphone. And
it's a smartphone, or you can access it through any other kind of computer. But yes, you have to have access to the internet.
Yes.
We are working on a number of different ways to get into and to be able to serve other areas, potentially those that need our kind of service more than others. We are developing a USSD solution, which will enable people to purchase directly from their feature phones, but we'll also look to work with partners to be able to deliver our service into the less well-off areas.
So when you say upload something into the system, so assuming I went to the hospital and got a prescription, then I could either take a picture or I could scan it, and then this sort of somehow gets into your system, and then the dispensation gets out. What's the checking out system, and what would I have to do? Would I literally, after you fill my prescription, be able to receive an invoice which I pay maybe through M-Pesa, and please take us through something?
That's almost exactly how it is.
Yes.
You've got your smartphone in your hand. You would really just take a picture of your script. It's uploaded. We transcribe it through our qualified people, place it into your cart. From there on, it's very much the same as any e-commerce solution. You would go into your cart. You would then see the products. You would accept it. You would check out. When in the checkout process, you also then select a pharmacy of your choice, of your convenience. So that may be a pharmacy that you can go to during a lunch hour, or it may be a pharmacy that's close to your home. So either way, it's somewhere that's convenient for you, and you can pass by there and pick up your product.
So you already have these as partners, and
yes, we have a number of. Although we launched last week, we have well in excess of 100 pharmacies within Nairobi that are partnering with us. So it's very important for us that we are seen as inclusive. So we are very much partnering with pharmacies to make sure
Aren't they seeing you as a competition, literally? Because cutting out the middleman means that you put some of them out of some sort of business.
Well, I certainly think the 115 or so that have partnered with us already don't see us as competition, and that's the very important thing. They're not our competitors; they're our partners, and we will bring them services. So if somebody wants to purchase through our platform, they will select a pharmacy of their convenience, which is one of our partner pharmacies. And we will deliver there. So we're not in any competition with our pharmacies. In fact, we're working very closely with them.
Yeah. Well, one of the greatest challenges for many Kenyans in the past has been sort of standardization of services. The fact that there has been no way of knowing whether the drug you're buying is fake, real, generic, or otherwise. And then the service you get in Nairobi, in another different part of the country, really different. The quality of service you get in one part of Nairobi differs really in a big way from another part of Nairobi. What does something like this mean to a consumer, especially in terms of knowing that there is so much fake medicine in this country, peace of mind and convenience?
And that's something we want to bring to the consumer, is the confidence of the product that they're buying. So whether it be a My Dawa own brand product,
yes,
where we're able to secure the supply chain from production to the patient, or whether it's another manufacturer's product that's available through our solution.
Yes.
Each one will carry a unique authentication label, and that authentication is more than just a scratch card. You can use the app, you can scratch a number, you can SMS it, you can put it into the portal or use a QR code to send that through. And that will bring you back a message, and that message will be a personalized message,
yes,
which will have the patient's name, it will have the product, and the fact that it's a genuine product. So for us, everything that we will deliver through our platform will be a genuine product that patients can authenticate, and we urge everybody who purchases through us to do that very thing.
Okay, just before we go, you mentioned securing the value chain from end to end. You've been able to literally partner with people at the individuals, companies at a global level to have your own sort of brand and be able to then assure consumers that this is something you've policed through the value chain.
Absolutely. Although we launched last week, this has been a 2-year project in the making, and a big part of that is to go through the manufacture process, work with a regulator to ensure that those products are all properly regulated, as you would have to do with pharmaceutical products, and then have them manufactured and be able to bring them to consumers. So yes, we've managed to secure that complete supply chain.
Yes, and just before you go, the website again, what was that?
www.mydawa.com.
Okay, indeed, then viewer from wherever you're from, of course, you can choose to take a look at that product offering right there, bringing you peace of mind when it comes to pharmaceutical services and indeed your health. The fact that, well, most Kenyans have had a problem with knowing the genesis of your medicine. Is it fake? Is it real? Is it something that is generic? And of course, this can be delivered to your convenience. Well, we want to proceed in a short break now, but before we go, just remind you of our Twitter poll question where we expect you to talk to us. Do you think online-based solutions will have any impact in Kenya's health system? Again, do you think online-based solutions can help improve Kenya's health system? Talk to us. The hashtag is Business Today. Reach out to me on @PeterWakaba or on @KTN News. We'll sample those results as the show does go on. Well, we now want to proceed on that short break, but on the other side of